the appropriate test is a PCR. So that is the gold standard for clinical diagnosis. Now, that said, that is not what we are doing here. What we are doing is public health surveillance. We're doing asymptomatic population-based screening. For that indication, the most appropriate test, the best test, the gold standard test is antigen testing. Why? Because it tells you more accurately, I'll repeat that, more accurately than the PCR, the information that we actually care about, which is not whether there's virus or not, it's whether there's contagious virus, whether someone is infectious, whether they can spread the disease. So a PCR result, being more sensitive, often picks up dead virus, deactivated virus, viral fragments, residual viral pieces from infections from which people have recovered that are no longer a threat, no longer pose a risk, are no longer a reason to exclude somebody. Conversely, the antigen test is only positive in cases when the viral load is high enough that people are contagious, they're infectious, they can spread it to others, they're a risk. So if an antigen test is positive, that's concerning. That means you should stay home. That means we should isolate. But a PCR test, might tell us that someone's positive when they had an infection a week ago or 2 weeks ago or 3 weeks ago or a month ago. And that person's not a risk anymore. And to exclude that person is a real harm. It's harmful to that person. It's harmful to their classmates. It's potentially harmful to the whole class if there's been close contacts. And, now we need to isolate more people or shut down a cohort. So false positives are a real issue. And that's the problem with PCR. So antigen tests are more accurate for what we care about, contagious disease.